Hi, Dr. Libby here. I want to talk a little bit about then versus now. So, I practiced family medicine for 15 plus years, and I saw lots of patients on a regular basis who had a wide array of gut related symptoms. And my typical approach was something like this: I would usually listen to their story, listen to their symptoms, and do an exam, and then try to match a medication that I thought was going to help their symptoms. So, maybe irritable bowel syndrome, we'd try a medicine for that. Maybe they had heartburn, we'd try a medicine for that. And if it worked, great. And if it didn't, then we look a little further, maybe some blood work, maybe some imaging CAT scan of the abdomen, something like that. And in my early days, I would oftentimes send them for a stool test. I quit doing that after a while because I was never finding anything on these stool tests. I mean, I sent tons of people, and it was a real pain in the butt. Excuse the pun, but I'd order the test. They'd have to go to the lab to pick up the container. They have to go home, collect a stool sample, take it back to the lab to have the test run, only to find out the test results were normal. And as were all the other things, right? And so when this happened, we would send them to a GI doctor for colonoscopy, EGD. Sometimes this would find the source of the problem. But there was a large percentage of the time where all of that was normal, right? So I had tried my tricks. We had done some imaging, we'd done some labs, we'd seen the specialist, and there's still no answer. What to do then, right? And the truth is, back then I didn't know. Now I know a comprehensive stool test, not the kind the insurance pays for, but the other kind that really gives us a ton of information. This is what I do with my patients now. It contains 5 pages of gut bacteria, and we always find something in this test. And part of the reason is we're looking for so many more pathogens than we were in the conventional setting, but also because the technology is DNA PCR technology. So we're not relying on someone to look under a microscope in a lab to see if they see something or not. We're actually testing for the DNA of the gut bacteria. I say it's kind of like crime scene investigation of the gut, right? So, my first experience with a stool test was this. I was taking my very first functional medicine course through the Institute of Functional Medicine. So, this was like blowing my mind because it was very different than the conventional training I had been through. And as part of the conference, I was offered a free stool test. And I thought, I don't really have any gut problems, but it's free. Why not? So I collected a stool sample and I sent it off. Now, I was still working as a family practitioner back then, and I was at work a few days later. I'm seeing a patient, and the office manager knocks on the door and she said, "Hey, did you send some like stool test to the lab company that she'd never heard of before?" And I said, "Oh, yeah, why?" And she said, "Well, they're on the phone and you aren't allowed to submit the free test on yourself. You have to use it for a patient, kind of conflict of interest to get a kickback from the company kind of thing." I didn't realize. I'm like, okay, fine. And they said, "But they want to know, they have your sample, they're willing to run the test, but you just have to pay for it." And the test was like close to $400. And I thought, gosh, I don't have any gut related symptoms. Do I really want to pay $400 for a test? But I'd gone to the trouble of already sending it in and I was kind of curious. So I gave my credit card number, paid for the test, got the results a couple of weeks later. And there were like several things wrong. The biggest of which was I had a parasite infection in my gut. So, this was early in my functional medicine training. I still didn't know a lot, but I did some research. And interestingly, in my conventional websites that I was looking on, they were kind of saying, yeah, this is not a big deal. You don't really have to do anything about it, this particular low grade parasite that I had. And in my functional medicine sites that I was looking on, they were like, oh my gosh, it's never normal to have a parasite. You always have to do something about it. So I ignored it for a while, but eventually I treated it. I put myself on a 2-month herbal regimen to kill this parasite. And I think like the reverse of the placebo effect was happening for me because I didn't think it was going to really work. But I took the prescribed regimen every day. And about 1 month into the 2-month regimen, I noticed a couple of things. I got out of bed one morning and I wasn't as achy and stiff as I was used to being. Now, I wouldn't call this terrible achiness and stiffness that I'd been having. I just thought it was like, I'm getting older. This is what it feels like to be in my 40s now, right? But it was noticeably different and nothing had changed with my workout routine. So I thought, this is great. I noticed my body felt a little bit less swollen, subtle but noticeable, and kind of gross, but I was having a really normal, complete bowel movement every morning, and it felt really amazing. So, all of these things were happening as I cleaned my gut up. And I didn't really have any gut related symptoms. I just thought this was all normal for being in my 40s, right? The other thing I noticed was my energy, which was already getting better because I'd already done a lot of work on my adrenals at this point, but that got even better too. And so I just want you to know that there is so much more to be done with your gut than what conventional medicine has to offer. And even if you're not having gut related symptoms, it may be worth having your gut checked because what's happening in your gut doesn't necessarily stay in the gut. It can be creating lots of inflammation and lots of things that can lead to other symptoms. So I'd love to help you fix your gut. You can contact us at hello@bestlifefunctionalmedicine.com or visit our website, bestlifefunctionalmedicine.com, and we would be happy to help you find out what's happening in your gut and fix it. Have a great day. Bye.